Good morning, everyone. Today we are going to talk about the different types of different immunotypes. I read this book of Heather Moody, which I got really inspired about. She's a medical doctor, and she offers a totally different approach to healing condition disease. So, as you know, I'm very, very passionate about assessment, evaluation before suggesting any type of protocol for healing a disease. And that's why I like the fact that she offered that quiz for you to fill out and to find out what type of immune system you have, and then to approach this type of immune system with the appropriate tools in order to heal. So there is a quiz in the PDF I'm offering. Just write PDF below and I will send you the PDF or some of my assistants. After you find out which type of immune system you are, you can send me a screenshot of your results and I can get back to you with ideas of how to approach your healing. So there are four types of immune system according to her, and she very nicely tried to put different groups of people in those four groups. I just want to mention that it is very, very difficult to do so, and I applaud her for doing so, because we human beings are so different. The way we're different outside, the same way we're different inside. So she's done a great job. That's a lot of work to define different type of immune systems. I will be talking about them and what to do according to her and to my experience as well, to help those types of immune system to get back to balanced immune system. And also in this presentation, I will tell you about a case. We'll work on one case, so you have a clear idea about the messages the body is sending us throughout life. When things start to go wrong, it's very important to know what did you do so things started to go wrong. So first, let me mention the four immunotypes. First of all, it's the smoldering immunotype, and we'll work on a case study from this type. There we have the weak immunotype, the hyperactive immunotype, and the misguided immunotype. So we'll talk about how to fortify a weak immunotype or immune system, how to cool off a smoldering immune system, how to calm our hyperactive immune system, and how to redirect misguided immune system. So hope you'll stay for it. It's not too long. It's going to be about 30 minutes or so. Before all this, let's get to the case study for a smoldering immune system. I'm telling you this on purpose so you right away notice the changes that led to that smoldering immune system. We will have, for example, Greg. Greg was 55 years old. This is the example, meanwhile, she gives in the book, and I decided to stick to it. For the most people, the age of 55 years old is when we notice things going off. In other words, we are far enough gone to realize that things are off. So we have a condition developing. So Greg was executive for a petrochemical company. His primary care doctor told him that he needed yet another medication to deal with his high blood pressure. He also warned that he was pre-diabetic and might need medication for that soon as well. what did Greg do to get to that moment? He put his career first in his life, often working 10, 12 hours a day. And yes, he had climbed the company ladder quickly, and he got a very influential position. But he became adrenaline junkie, always up for a challenge, and loved closing a deal more than anything. So he was under adrenaline rush for the most of the time. He traveled extensively, often to China, South America, entertaining clients and eating out on expense accounts. He dealt a lot with jet lag, and recently the jet lag had been getting harder for him to bounce back from, and he often found himself waking up at odd hours and usually getting no more than 6 hours of sleep at night. So Greg's story can be also every a woman or man's story who work full-time, take care of a family, and they are constantly on the go, on the run. And on top of it, they also train, like Greg. He's done CrossFit workouts for a few years. He liked it, but lately he had become quite sedentary due to this schedule. And let me tell you, the more sedentary you become, the more difficult it is to get up and train. And ideally, what I offer to my clients is to have different trainings throughout the week, and to those who are very sedentary, to get up and do half an hour something, or 20 minutes 3 times a day, not to beat up the body in 1 hour and then to pass out on the couch and ruin the day because they have no more energy left to live their life and to perform their duties. So nowadays, he rarely found the time to get to the gym, and frankly, he didn't feel up to it anymore. So he was also starting to forget people's names and didn't feel his thinking was as sharp as it used to be. His father had Alzheimer's disease, so this really worried him. And let's pause here for a moment. In this case, we all have some genetic predisposition for a disease, but not all of us get it. And how does it happen? They say that in order for the genes to turn on, you need the environmental predisposition. You need that stress, or you need that bad food, or you need to experience a lot of jet lags where the body doesn't know when should recover, when should wake up, and etc. So that term, the epigenetics, epi means above genes, triggers or turns on and off the genetics. And I've only seen one case when the woman was very healthy and done everything to the book, was very active. She was an engineer. She built highways in another country, and until the age of 55 or 54, she was able to read and to work on her brain. And then her eyes degraded, and she started getting, at the age of 85, the dementias symptoms which her mother and her grandmother had. So she was predisposed to that disease. And when the environment became a really favorable to open those genes, we started noticing different things of beginning of that disease. Now she's 87 years old, and still the disease is progressing very, very slowly due to her lifestyle. So here is how it worked in that one type. But let's get back to Greg. To buy his energy after less than restful sleep, he would start the day with his high octane bulletproof coffee. So that bulletproof coffee would really keep him on a roller coaster for the day, because there will be another coffee in the afternoon. He usually also skipped breakfast or grabbed granola bar, and I would say, do not eat granola bar, please. I don't know how to explain it. It's bad for you. It's total carbohydrate. There is no protein whatsoever. Never mind, they write on it, there is nothing which will be absorbed as protein from the granola bar, because these are usually plant proteins. They need a lot of the plant, the rest of the molecule, in order to be absorbed, assimilated, or worked from the body into a protein from amino acid. So granola bar also have artificial sweeteners, or they have those sweeteners like agave, stevia, which I don't recommend to clients. Also, granola bar is very, very dry, and it gets a lot of water to be expelled, water that the body can use for something really better. And frankly, no nutrients go through from those bars in you. So a lot of people do that because they have to keep going, because it is pure sugar, actually. And he was taking out for lunch food, and often getting more coffee and sometimes sweets, so to boost his energy in the afternoon, so to keep going. The coffee I mentioned again. So when he wasn't doing his clients' dinners, he would go home for dinner, but that dinner would be often after 7 p.m. And here I would like to say, not only because of the circadian rhythm in your cells, but also age-related reason, we have to stop eating around 4 or 5 o'clock, preferably 4 o'clock. Just we don't have that at this age metabolic resource for really high metabolism that can assimilate that food, so you can sleep nice and quiet, and your body is not busy with digesting your food, but repairing the damages that occurred during the day. So very common for him was to relax with, let's say, whiskey or 2 glasses of wine, and with his wife and his wife, not, I would say, with his teen son, but probably he would have some arguments or interesting talks before bed that are another disruption for sleep with his teenage son. So over the past 4 years, he had developed aches and pains in his knees, hands, and feet, for which he would pop a Tylenol or Advil sometimes. He had developed a skin condition called rosacea on his face, which his doctor attributed to his Irish heritage, and struggled with patches of psoriasis on his elbows. He often had heartburn and had been taking medicine for that for years on. So consider the side effects here. And he's been on and off this medication. And what else? His blood pressure started getting up higher, so he was on one high blood pressure medication. The doctor said, I told you in the beginning that he needs to get another one. His cholesterol got higher. also, so medication for the cholesterol as well. He was borderline obese. He was having gained more than 30 pounds in 2 years. Having in mind that we lose 1% of our muscles after the age of 45, 1% per year from our muscle mass. It's very, very serious to be borderline obese or to lose 30 pounds in 2 years, because the loss is mostly of muscle mass when it becomes natural due to stress or etc. Like that, or for in his case, he gained more than 30 pounds per year, which the gain is mostly fat. Especially if you don't train, you can't really gain muscle mass at the age of 55, which he was. So also the diuretic they would give him to because of the high blood pressure, in order to urinate more often, would interrupt his sleeping patterns. And he's also noticed that his erectile dysfunction was more and more frequently. At his last doctor's visit, his blood sugar has been higher. So you see how progressively Greg got sicker and sicker. So he always thought of himself like he was very tough and resilient, but Greg's habits and lifestyle were driving him a lot of the inflammation in his body, which is that smoldering type of immune system. And they were setting multiple disease in motion. So those symptoms, as I said, they showed clearly the smoldering immunotype, and maybe many of you are recognizing the same patterns in your life. And in a bit, I will tell you how to work on the smoldering immunotype. Before that, let me mention that the root cause of this type of immune system is too much inflammation, throwing the entire body out of whack, so to speak. So those with a smoldering immunotype don't always have a diagnosable disease, because how would they diagnose aches and pains? Sometimes it takes years to diagnose something like fibromyalgia, and many of you who are listening to this video, I'm sure you will confirm that. Nor people are sick enough to stay home or cancel their day, but they typically have a lot of things going wrong at the same moment, and these are the signs that the body sends us to tell us that yes, there is something which is developing. For example, a little bit of insomnia, aches, pains, brain fog, some chronic stress, for instance, occasional sexual dysfunction, and labs that are in the worrisome category, but not necessarily in the needs medication category. All these cannot be really diagnosed with a disease. The good news is about this immunotype is that with a few key lifestyle changes, you can reverse this negative cycle of inflammation, and your symptoms should improve very rapidly. So remember that out of control inflammation is the core of many, many diseases that we suffer from today, and most importantly, like heart disease, metabolic syndrome and obesity, diabetes, autoimmune diseases, Alzheimer's, to name a few. So also, once your inflammation is under control, your immune system can pay attention to the really important things like effectively killing dangerous microbes and helping you live a long, healthy lifestyle. How do we cool off the smoldering immunotype? Oh, first of all, we avoid alcohol and sugar. This is a rule which is not for discussion with my clients. I start soft in the beginning, but then the time comes when we discuss it and I say, look, this is for life. No alcohol and no white sugar more than once a week or once a month even. That's it. If you would like to be healthy and avoid developing different type of diseases. To reduce inflammation, we very often use curcumin. This is one of the things, curcumin is anti-inflammatory. We can find it in many shapes and forms. I would like to recommend a dose to my clients, depending on the evaluation I've done on them. There is something which people buy over the counter, and I see it's very popular. I don't have experience with this. It's resveratrol, which is very rich in polyphenols in very high doses, which is antioxidant and anti-inflammatory. You can do that too. You can buy it online. You can buy it in the pharmacies. And I would suggest berberine. She suggests that in the book as well. Berberine is, this is a compound actually, which is found in different plants like golden seal, barberry, Oregon grape, and it's a huge player in down-regulating inflammation and reducing oxidative stress in the body. It has strong antimicrobial properties, and it's commonly used to treat bacterial infections and overgrowth in the gut that may be driving chronic inflammation. I am a big proponent of berberine. It has also been shown to increase insulin sensitivity and improve blood sugar regulation. So, in fact, in a study putting berberine against the common diabetes drug metformin, berberine was equally effective in lowering fasting blood sugar, insulin, and hemoglobin, while also lowering cholesterol and triglycerides as well. So overall, this compound is amazing for smoldering immunotypes, especially those with metabolic syndrome, including obesity, high blood sugar, and heart disease. The recommended dosage is about 500 milligrams taken 3 times daily. I prefer to suggest herbs, that the 3 herbs I've mentioned that have berberine, because Mother Nature put those molecules in a way that they act as a chip to our computer. As soon as you take it from the natural source, the body can recognize it for a healing substance and use it immediately without any side effects. There might be some reactions, but they go away for about 20 minutes. I'm talking sometimes with herbs there are rashes, for instance, or supplements. If you take CoQ10, you can get rashes. If you take vitamin B3, you can get all red and heated, but it goes away in less than 20 minutes. Of course, some of the herbs have contraindications, and that's why you have to ask someone who knows what they're doing while recommending you herbs. From the PDF, which I've mentioned, where you can measure or find out what kind of type you are, I would like just to mention a few things about all the different types quickly. So the weak immunotype is this immunotype that have a congenital and acquired immune deficiency. It also has taken immunosuppressive medications such as chemotherapy. It has more often than once pneumonia, or it gets frequently urinary tract infections, often feels run down, have to sleep longer than 8 hours in order to recover, get sick after periods of stress, has many colds for that last for a week, so that immune system is weak. It cannot provide resources for fast healing. So this is the weak immunotype. Then we have the hyperactive immunotype. And straight from the PDF, would take you just a few questions in the quiz. They ask you if you had asthma or chronic cough, history of sinusitis, that you have seasonal all year round energy, if you have also swellings, breakout in hives, you have allergy reactions to medications, sensitive to mold as well. You have bronchitis, pneumonia, if you sneeze frequently. This is all hyperactive immunotype, very common as well. Then we have the misguided immunotype, and this is when you have family history of immune disease, autoimmune disease, sorry, like rheumatoid arthritis or lupus. If you have joint pains that come and go, or swollen joints, have thyroid disease, stress makes certain symptoms flare. I have a lot of clients who under stress experience physical pain due to, let's say, the disease they're going through or condition, have chronic muscle pain or chronic muscle weakness and pain, get tingling and numbness, not only on the extremities, but getting other neurological symptoms, have mysterious skin rashes just coming and going, dry mouth and ear and eye, maybe ear as well, have taken many antibiotics, has childhood trauma, and etc. This is the misguided immunotype. And then you have the smoldering immunotype, like Greg. So how to calm a hyperactive immune system? First of all, you can take quercetin, which is a very powerful antioxidant. You can take astragalus root. Astragalus root is used a lot for allergies or allergic reactions. My favorite herb is perilla. Perilla is part of the mint family and is one of the 50 most important herbs in the Chinese medicine. Perilla reduces allergy reactions. Stinging nettle, which leaves have antihistamine properties. And so, yeah, that's it is for this type of immune system. Then we have to redirect the misguided type of immune system, which Heather Moody suggests to take vitamin D and vitamin A. I will talk about that in just in a minute. I would like to mention that it's very important to do dieting to find out which foods are supported by the digestive system, and the digestive system can assimilate nutrients from them. We do also something which is called elimination diet. She also talks in the book about that, when you eliminate foods and bring them back in order to see if those foods were causing the problem people have. Vitamin D deficiency can lead to a risk of autoimmune disease. So if you have those genes, or due to stress or etc., those genes can open up to procreate that autoimmune disease. You might want to see your vitamin D levels in a blood test, asking your doctor to suggest to refer you to a vitamin D or other vitamins deficiency. Another vitamin which is very important here is vitamin A, which is very strong antioxidant. I would say skullcap. Skullcap is a herb which is used as antioxidant and healing autoimmune disease. Then we also have glutathione, maybe the most powerful antioxidant which is produced in our body. Be careful, because they sell a ready-made glutathione. Unfortunately, the body doesn't take that. The body needs the precursors, and there are quite a few, to produce glutathione. So then we have the weak immune system, which we need to fortify. How do we fortify the weak immune system? Mushrooms. I have videos on mushrooms, shiitake, maitake, lion's mane, and etc. Those mushrooms support, fortify, nourish our immune system, because they call them immunomodulators. So they have a very immunoboosting properties. Or immunobalancing properties. One of the also plants is ashwagandha. Ashwagandha is adaptogenic supplement for stress. Korean ginseng also effects on the immune system, has great effects on the immune system. Colostrum powder. Colostrum is something which is produced 24 to 48 hours after giving birth, and it provides the babies with immunity. When you buy colostrum powder, it's made of cow or goat usually. Elderberry helps with upper respiratory infections. It's very important that the infection does not go through the respiratory tract and to cause all these bacteria, bad bacteria, to go deeper into the lungs. So elderberry works on the upper respiratory tract. And yeah, this is all about it. These are the 4, again, immunotypes that, according to this Dr. Heather Moody, we have, which again is a very, very interesting angle of seeing of a human being, and how we can help people to recover from chronic disease. And I will repeat the immunotypes. So we have weak immunotype, which we have to fortify. We have a smoldering immunotype, which we have to cool down. We have a hyperactive immunotype, which we have to calm, and misguided immunotype, which we need to redirect. So this is all for today. Thank you for listening, and I hope that this was really something that can help your healing from chronic disease. If you would like to hear more, follow us either on YouTube, Eliminate a Chronic Health Condition is the name of our channel, or Facebook, we have the same name group, Eliminate a Chronic Health Condition, or also on Instagram, The Holistic Lifestyle Coach. And if you have any questions, my name is Mariya Taneva. I'm answering questions in those channels, or get in touch directly with me. My phone number is 778-779-1203, and this is Pacific, Canada. Thank you for listening.
Join our Healthy and Community Facebook group. If you have any questions, please free to comment below. Don't forget to follow and subscribe for more.